Welcome to This Week in Psychiatry. This week we're covering 10 notable papers spanning neurodevelopment and environmental risk, novel therapeutics for severe mental illness, and future clinical strategies for dementia and youth mental health. Let's dive in. First, we'll look at how a child's environment shapes brain development and psychiatric risk. A major study in Science examined brain-wide associations for hundreds of variables in children and found that socioeconomic status, or SES, showed the strongest link to brain variability. Interestingly, these associations were strongest in motor and sensory regions, not necessarily higher-order cognitive areas. This same brain pattern was also associated with IQ, but when the analysis adjusted for SES, the link between brain structure and IQ was substantially weakened. The findings suggest that a child's socioeconomic environment is a primary driver of brain variation, potentially through mechanisms like stress and sleep deprivation, and may confound our understanding of the neurobiology of intelligence. Another key environmental factor, social media, was the focus of a large prospective study in the American Journal of Psychiatry. Following over 7,000 adolescents from age 10 to 15, researchers identified 4 distinct trajectories of social media use. Compared to adolescents with no or very low use, those with moderately or rapidly increasing social media engagement had significantly higher odds of experimenting with alcohol, cannabis, and nicotine by age 15. The risk was most pronounced for the early onset, rapid increasing group, who, for example, had nearly 17 times the odds of cannabis experimentation. This provides strong longitudinal evidence linking patterns of social media use in early adolescence to subsequent substance use. These environmental studies provide context for the rising incidence of neurodevelopmental disorders. A fascinating cohort study in JAMA Psychiatry explored why rates of ADHD and autism spectrum disorder have climbed over the past 2 decades. Using Danish population data from 1994 to 2016, investigators found that as the years went by, individuals receiving a new diagnosis of either ADHD or ASD had, on average, a lower polygenic risk score for these conditions. This finding strongly supports the hypothesis that the rising incidence is not due to new environmental risk factors creating more pathology, but rather to a broadening of diagnostic criteria and increased awareness, which now includes individuals with milder, less genetically driven presentations. Finally, rounding out the theme of environmental impact, a study in molecular psychiatry looked at the connection between air pollution and Alzheimer's disease risk in cognitively normal adults. It provides evidence that DNA methylation in the blood may be a key biological mediator. The researchers found that exposure to fine particulate matter was associated with lower levels of amyloid beta in the cerebrospinal fluid, a preclinical sign of Alzheimer's, and that this relationship was partially explained by epigenetic changes in genes related to neuroinflammation. Next, we turn to novel neurobiology and therapeutic targets in severe mental illness. A meta-analysis in the American Journal of Psychiatry investigated iron and neuromelanin in the brains of individuals with psychosis. It revealed a complex and seemingly paradoxical pattern. Patients had lower levels of iron in subcortical regions overall, but higher levels of neuromelanin-bound iron, specifically within the dopamine neurons of the substantia nigra. This increase in neuromelanin signal was correlated with antipsychotic dosage, raising questions about whether it's an effect of medication or the illness itself. These findings point to a dysregulation of iron homeostasis as a potential pathophysiological mechanism in psychosis. Sharpening the focus on new targets, a PET imaging study in biological psychiatry provides some of the first in vivo evidence for deficits in muscarinic M1 receptors in schizophrenia. Compared to healthy controls, patients with schizophrenia showed significantly lower M1 receptor availability across multiple cortical and subcortical regions, with reductions ranging from 13 to 19%. This provides a direct biological rationale for the development of new treatments, like M1 and M4 receptor agonists. For mood disorders, a key challenge is treating anhedonia. A randomized controlled trial in Nature Medicine offers a promising strategy, evaluating the dopamine agonist pramipexole as an add-on therapy for patients with major depression, dysthymia, or bipolar depression with significant anhedonia. Over 9 weeks, patients receiving pramipexole had a significantly greater reduction in anhedonia scores compared to placebo, with a moderate effect size. The treatment was well tolerated, and the benefits appeared to be sustained during a 6-month open-label phase, supporting its use as an augmentation strategy for this difficult-to-treat symptom. Finally, we'll cover 2 papers on clinical strategies and future directions. A narrative review in JAMA Psychiatry revisits the potential of lithium as a disease-modifying agent for mild cognitive impairment and Alzheimer's disease. The authors summarize extensive evidence showing that lithium acts on multiple neuroprotective pathways, such as enhancing BDNF and inhibiting GSK3 beta. Crucially, they highlight that robust neuroprotective effects are seen at low doses, around 0.3 mm, which are significantly lower than standard psychiatric doses and may mitigate risks to the kidney and thyroid. The paper makes a strong case for a prospective clinical trial of low-dose lithium to slow disease progression. And in the realm of youth mental health, a study in the Journal of Child Psychology and Psychiatry tested a web-based gatekeeper training resource for parents. In a randomized controlled trial, the intervention successfully improved parents' self-efficacy in recognizing mental health problems, boosted their perceived knowledge, and reduced barriers to help seeking. However, the training did not significantly change their underlying mental health literacy, stigma, or intentions to seek help. This suggests that while such tools can build confidence, additional strategies may be needed to translate that confidence into action. If you only have time for one paper this week, make it the study of pramipexole for anhedonic depression in Nature Medicine. It's a well-conducted, positive trial providing a much-needed, evidence-based option for a core symptom of depression that often persists despite standard treatment. Here are the key takeaways from this week in psychiatry. First, for patients with persistent anhedonia in mood disorders, adjunctive pramipexole is an evidence-based option, showing significant improvement in a new placebo-controlled trial. Second, the rising rates of ADHD and ASD diagnoses are likely driven by broadening diagnostic criteria rather than new risk factors, as the average genetic loading of diagnosed individuals has decreased over time. Third, early and rapidly increasing social media use in young adolescents is a major risk factor for subsequent substance use experimentation, with odds increasing dramatically compared to low-use peers. Fourth, there is growing in vivo evidence for M1 muscarinic receptor deficits in schizophrenia, providing a biological rationale for emerging treatments targeting this system. And finally, keep an eye on low-dose lithium as a potential, accessible disease-modifying agent for mild cognitive impairment, with a strong rationale for further trials. That's your roundup for This Week in Psychiatry. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. If this weekly briefing is useful, follow the show in your podcast app so new episodes arrive automatically. And for audio briefings on your own clinical questions and papers, visit audioscholar.cc. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.